Hi, my name is Asosa. Today I'll be talking about secondary prevention. This is week 9 of health promotion, a discussion topic that I have for the well adult case discussion. Secondary prevention, and at the end I'll list my references for everyone to be able to see where I got my information from. So what is it? What is secondary prevention? Secondary prevention is screening to identify diseases in the earliest stages before the onset of signs and symptoms through measures such as mammography and regular blood pressure testing. An example of secondary prevention is pap smear, which is a form of secondary prevention aimed to diagnose cervical cancer in its subclinical state prior to progression. And this is good because most prevention suggestions are primary or secondary prevention efforts for individuals. According to the CDC, or Centers for Disease and Prevention, the health of the American public has improved on many fronts over the last decades, from decreasing incidence of lung cancer in men to large reductions in the number of childhood lead poisoning cases. Many diseases and illnesses are increasing in frequency. Though the reason for these increases are often unknown, to the extent that the causes are recognized or suspected, preventative measures are desirable. Public health forces focuses on prevention of disease and health promotion rather than diagnosis and treatment of disease. On the side I have a little chart of primary, secondary, tertiary prevention, as well as another one. Literature regarding secondary screening. The U.S. Preventive Services, or Task Force, describes secondary prevention measures as those that identify and treat asymptomatic persons who have already developed risk factors and preclinical disease, but in whom the condition is not clinically apparent. These activities are focused on early case findings of asymptomatic disease that occurs commonly and has significant risk for negative outcome without treatment. Screening tests are examples of secondary prevention activities, as these are done on those without clinical presentation of the disease that has a significant latency period, such as hyperlipidemia, hypertension, breast and prostate cancer. With early case finding, the natural history of disease, or how the course of an illness unfolds over time without treatment, can often be altered to maximize well-being and minimize suffering, which is always great. Now, statistics regarding secondary screening. Law-making workplaces, restaurants, bars completely smoke-free can reduce heart attack hospitalizations by 8 to 17% within a year. Federal laws that address U.S. air quality have contributed to a decrease of 54% of 6 common air pollutants since 1980. These are just a couple, or this is just one of the two screening statistics that I have here, just to show how important secondary screening is. Now, the clinical significance of secondary screening. Preventative services have proven an important aspect of healthcare. However, they appear consistently underutilized in the U.S. With cost, time, and resource constraints on physicians, as well as APRNs, which we will soon be, many preventative services get overlooked for patients. It is important for physicians and APRNs to remain up to date on the prevention guidelines and ensure all patients are offered appropriate services with a full explanation of risk and benefits. Examples of secondary screening. As mentioned before, a pap smear is an example of secondary screening for early detection of cervical cancer. Mammography, which is for early detection for breast cancer. Colonoscopies, which is for early detection of colon cancer. And blood pressure screening, which we know can help detect a wide variety of issues: high blood pressure, preeclampsia, a lot of different disorders. Now, are there any risks in secondary screening? While preventative services are regulated and must undergo scrutinous safety testing, there is risk involved with prevention, particularly primary and secondary preventative factors targeted and intervening in healthy appearing individuals. It is often challenging to gain buy-in with patients regarding the risk-benefit ratio of various preventative services. So that's always an issue. Basically, to summarize this point, is the risk in it is how to get healthy patients to get screened. Their point would be, I'm already healthy, why do I need to get screened? So that would be the only risk in trying to get healthy people screened. Cost. The cost of preventative services is commonly a topic of discussion. Several cost-benefit analyses have been undertaken regarding the evaluation of preventative services with varying degree of confidence. While often a long-term gain of healthy life years is noted, preventative services are not inexpensive, which means it's expensive, which can limit the use of these services by both healthcare systems and patients, and is a consideration when promoting preventative services. So as APRNs, we want to do our best to educate our patients on the most cost-effective way to go about seeking preventative services. The prevention framework. There are 3 types of preventions that can be utilized to aid in the screening of the general adult population. There is local prevention, state, and national prevention. Let's start off with local prevention. Beyond individual prevention efforts, local community actions can be particularly effective in bringing about changes that prevent or reduce environmentally related illness and diseases. Strategies ranging from community education to neighborhood awareness around the environment health issues are some of the actions that can be taken on the local level alone. Information sharing between neighborhoods, associations, faith communities, and community-based organizations and other local groups can highlight gaps in service and facilitate coordinated efforts to achieve public health outcomes. State prevention. States play an important role in promoting both local and federal prevention efforts and also contribute to prevention through their own initiatives. For example, inspections and regulation enforcement at food service establishments, swimming pools, hazardous waste disposal sites, and other local locations help prevent illness and diseases statewide. State-sponsored efforts support health screening programs, anti-smoking campaigns, and health education. And as partners with federal agencies, states assist in implementation of programs such as the CDC's Childhood Lead Poisoning Prevention Program and the CDC's National Heart Disease and Stroke Prevention Program. Finally, national prevention. The Department of Health and Human Services, which includes the CDC and the US FDA, the Environmental Protection Agency, the Department of Housing and Urban Development, and the Department of Agriculture, all have a hand in prevention efforts. National prevention activities include initiatives, regulatory programs, and policies that establish nationwide programs to reduce both the presence of and exposure to harmful agents in the environment. Many agencies are involved in activities that either directly or indirectly reduce public exposure. So these last 3 slides show how important those 3 levels of prevention are important to the individual. Key component of prevention. One key component of prevention is awareness. Awareness is to provide information on effectiveness of interventions to inform policies. It is also to provide the public with health education information, to work with the media to highlight public health issues, and also to establish programs to proactively distribute information to targeted groups, specifically those at high risk for disease or injury. Though the individual, state, local, and federal efforts to prevent environmentally caused illnesses and disease have had some success, there are more comprehensive efforts that are needed to be in meeting the overall environment health challenges faced in the United States. Another key component of prevention is education. This is to educate and to inform decision makers, public health practitioners, healthcare providers, and individuals about science-based health prevention approaches that will have the greatest benefit and impact on public health. We need to educate workers both in and out of the health field who may have daily contact with people at high risk for disease and injury. These individuals can encourage healthy behaviors, screen for certain health risks, and contribute to education of the community. Our jobs as APRNs, I believe, as APRNs concerning prevention, specifically secondary screening prevention, is to educate our patients that we are taking care of, to let them know the resources they have available to them to help screen for any illnesses they may have down the line. And here are my references. Thank you all so much for listening to the presentation.